Have you ever gone to the doctor and you know that you have been trying everything you can to get your blood sugars down, and all of a sudden they're higher than they used to be, but you have not done anything different? Your diet is virtually the same, your physical activity is about the same, you're taking your medications. In fact, maybe you're even eating a little bit better, maybe you're even walking a little bit more, but your numbers are still going up. Sometimes the problem is not your food, it's not your physical activity. Sometimes it could be your medications. And one of the most common ones is actually a blood pressure medication. So, in this video today, I want to talk about 5 medications that can raise blood sugar and really get into how they do that. If you are new to my channel, my name is Dr. Takova Wallace-Gay. I am a board certified clinical pharmacist working in the primary care space, as well as an associate professor of medicine. Here on this channel, my goal is to help you understand your medications, feel more confident, and try to get rid of some of that confusion around all these medications, and really just to take them safely if and when you need to take them. And also, I think a big part of that is just knowing when to ask questions and how to ask better questions. And part of being able to ask better questions is being more informed about the background information. So, again, today we're going to talk about 5 medications that can raise your blood sugar. Now, I'm going to say this up front that these medications are not bad medications. Many of the ones I'm going to list help stabilize people, they help save lives, they reduce risk of things like having a heart attack or a stroke. And so I really want to make that clear that although they do have this physiological shift in things that can happen in your body, they're not inherently bad medications. And so once you understand that physiological shift that can occur, it'll help you really just to have better conversations with your healthcare team about how maybe you need to modify other things or switch to a different medication that's similar with less of an effect or anything like that. Like just to have a better and clear plan about what's going on. And the very last medication that I'm going to talk about actually surprises a lot of people, and many people are on it. So stick around for that one. But I want to start with one of the most common medications for blood pressure that a lot of people don't expect. And those are our thiazide diuretics. Some examples of thiazide diuretics are hydrochlorothiazide, which is HCTZ. Its cousins, chlorthalidone and indapamide, are also common thiazide diuretics that can be used. Now, as I mentioned, these medications are really common because the American College of Cardiology, American Heart Association guidelines recommend thiazide type diuretics as a first line treatment for high blood pressure. And rightfully so. There's a lot of benefits that we've seen in our studies with using thiazide like diuretics, getting sodium and water off the body to help reduce blood pressure. So millions, literally millions of people take them. They work by acting on the kidneys. Again, they specifically work by getting rid of more sodium, which allows you to get rid of more water. And they work kind of late in the kidneys, called the distal convoluted tubule. You don't have to remember that. Just know that all these different diuretics work on different parts of the nephron of the kidney, which is why they have slightly different effects on how they manage your water output and electrolyte output. So these specifically work later on the nephron of the kidneys, and they block a transporter called the sodium chloride transporter. So again, what that means is that your body stops reabsorbing sodium. And when sodium stays in the urine, water is like the little shadow. It follows it. So we get rid of more sodium, and therefore we get rid of more water. And by excreting and getting rid of more sodium and water, the volume of your blood decreases. And when we decrease that, your blood pressure improves. There's less pressure in those vessels. So how does this affect your blood pressure? Or excuse me, how does this affect your blood sugar now? There's a little bit of a metabolic connection here. Thiazide diuretics can also lower potassium levels. So although they act more profoundly on sodium, they also can lower potassium levels. And potassium plays an important role in insulin secretion from pancreatic beta cells, from cells of our pancreas. So when potassium drops, insulin release can slowly and slightly decrease as well. And so if you have less insulin, that means that more sugar, more glucose is staying in the bloodstream longer, because you may recall insulin is what actually takes that sugar from your bloodstream and puts it into different cells of your body so that you can use that for energy. So if you have less insulin, the more sugar stays in the bloodstream longer. And this can lead to a mild increase in blood sugar, even for someone who doesn't have a diagnosis of diabetes, for example. And it's also important to keep in mind that the dose matters as well. The lower doses, like HCTZ 12.5, usually are going to have a very minimal impact. But once you start getting to higher doses like HCTZ 25 to 50 or even chlorthalidone 25, because chlorthalidone is a little bit more potent than HCTZ. It's a little stronger than HCTZ in terms of the actions. And so once you get to those higher doses, you're more likely to see some of these metabolic changes. Another thing to keep in mind is that chlorthalidone has a really long half-life. That means that it stays in the body for a long time, somewhere around 40 to 60 hours. So that longer duration with chlorthalidone is one of the reasons why some primary care providers and often cardiologists will prefer it for blood pressure control. But that also means that the metabolic effects can also be slightly more pronounced or more profound. So just keep that in mind. If you're on any of these medications, they are going to lower that potassium a bit, which is going to reduce insulin secretion. And then, therefore, you're not going to have as much insulin around to get that sugar out of your bloodstream. Now, the next medication on this list is actually one of the most common reasons doctors see sudden spikes in blood sugar. And these are going to be our steroids. So some examples of steroids are things like prednisone, dexamethasone, methylprednisone. And steroids are some really powerful anti-inflammatory medications. They are used for a lot of things. In fact, I was just talking to one of the physicians that I work with, and he never, doctors are like the worst, right? He never goes to the doctor. But he went to an urgent care, and he was like, yeah, they were trying to give me a steroid. And I was like, yeah, I've been talking to people lately, and I feel like, we just throw steroids at a lot of stuff because they're going to get the job done. They are used for a little bit of everything, but we definitely use them in respiratory issues, to help with any inflammation. Like we use them in asthma, we use them in autoimmune diseases, severe allergic reactions. We also use them to help supplement therapy in certain cancers. But they are also one of the most common causes of medication-induced hyperglycemia. When I was a fourth-year pharmacy student, I worked with one of my professors to do a project where we looked at patients that were admitted to the hospital due to a COPD exacerbation or like a flare-up of their COPD. And one of the main things that we give people, as I mentioned, when they come into the hospital with these respiratory issues is a steroid. And so we were specifically looking at whether they had diabetes or not when they came in with a COPD exacerbation, how much of a spike in the blood glucose we saw and what effect maybe that had on the patient or the dosage of certain medications that they might have been given for their blood sugar. So it's definitely something, it's well studied, it's out there. We know that it's going to increase your blood sugar. And so we monitor for that and look out for that. But how do steroids do this? So steroids are really complex medications because they affect the body in so many ways. And really, I don't even think that we fully understand all the mechanisms of how steroids work and how they act. But in terms of increasing the blood sugar, we propose that it can do this in a few different ways. So first, they may increase what we call gluconeogenesis in the liver. So that means that they increase the genesis of glucose in the liver. So glucose, new genesis creation. So they increase the creation of glucose in the liver. And that means that the liver is going to just produce more glucose, right? And so our liver does that at baseline. We store glucose in its stored form. And then our bodies kind of create more and release more as we need it. But if you're already having high blood sugar, or if you're on one of these medications, it can kind of throw that into overdrive. And so we don't really want that. The second way that steroids can potentially increase the blood sugar is that they can cause insulin resistance. So in this case, insulin tries to take sugar from your bloodstream, put it into your cells, but your cells are resisting that. This can be your muscle cells, your fat tissue cells, all the cells of the body that utilize glucose for energy are starting to be a bit more resistant to insulin. So they're just not responding to insulin as effectively or as well as they were before. The third way that steroids can increase your blood sugar levels is that they reduce glucose uptake into the muscle and fat tissue. So not only are they making those cells more resistant, but they're also not putting as much glucose into the cells when they are able to get it in there. And so they're reducing that amount. So therefore, we have a higher circulating amount of blood sugar overall. So again, just thinking about steroids, these medications act in a bunch of different ways. They are given for a lot of different conditions, and even a short burst, like a dose pack, a Medrol dose pack or something like that, that you may be given just for a few days, can cause spikes in your blood sugar. So if you are someone who already has high blood sugar, or if you have a diagnosis of diabetes, even if your blood sugar is controlled, just be a bit more cognizant about what your levels are if you are having to be on a steroid for any reason. If you're on long-term steroids for something like an autoimmune condition, there's oftentimes not a lot of other options that we have in the short term. Steroids usually work really well, or we're getting into more expensive medications. And so just continue to be cognizant of your metabolic health and trying to do things that will help counteract that high blood glucose level, like leveling up your protein, continuing physical activity, things like that. So again, just be very aware that steroids can increase the blood sugar. Now, moving on to the third medication. This one's interesting because it affects both the blood pressure and blood sugar regulation. And so here we are talking about beta blockers. Some examples of beta blockers are things that end in olol, so metoprolol, atenolol, propranolol, bisoprolol. All of these medications, carvedilol, which is a really common one as well. And all of these medications are very often used for heart things. So abnormal heart rhythms. If you've ever had a heart attack, or if we're trying to reduce your risk of having a heart attack, we might use them. Patients with heart failure will likely be on one. Sometimes still used for hypertension, but they're not the first line for hypertension. It's usually if you have something else going on, or if you just have a really fast heart rate, then we will give you a beta blocker to help slow that heart rate. So the way that beta blockers can affect your blood sugars is that they essentially affect the metabolism of glucose, and they do that in several ways. So they affect how your blood sugar, how your glucose is being broken down. They can, one, decrease insulin sensitivity, and therefore, again, insulin is just not able to act on the cells of the body as well. The cells are more resistant, or they're less sensitive. So we can say that in two different ways. They're either more resistant or less sensitive. It means the same thing, essentially. Also, they can reduce insulin secretion. So we're just not putting out as much insulin from the cells of the pancreas. And they can also reduce blood flow to skeletal muscles. So because we're slowing the heart rate, the blood flow to different areas of the body is somewhat slowed as well, or reduced. And so therefore we're just not getting things to the muscle as efficiently as we were before. So all of these things can reduce muscle blood flow and impair glucose uptake into the muscles. Now, one thing that's really important to remember in terms of safety with beta blockers is not only can they increase your blood sugar levels in some instances, but they can also mask or hide the symptoms of a low blood sugar. So let's just say you're someone who has a diagnosis of diabetes, and also you're on something like metoprolol for AFib, for example. And one thing that will put you in the hospital faster than a high blood sugar is a low blood sugar. Low blood sugars are so dangerous. And symptoms like fast heart rate, shakiness, there are others that are not coming to me right now, but some of those symptoms of low blood sugar that we see normally are masked by beta blockers, because beta blockers are going to slow the heart rate. So even if your blood sugar is low, and normally that would cause your body to kind of rev up, because it's like, I need you to feed me, beta blockers are slowing all of that down. So you may not even know that your blood sugar is really low, which can be, kind of dangerous. So you want to make sure that you are keeping a close watch on that if you are on a beta blocker and also have a diagnosis of diabetes. It's really important for everybody with diabetes, but definitely important for people taking insulin. Just because we know that sometimes, if you, depending on the dose of insulin that you take and anything that can affect your blood sugars after a meal, you might see a bottoming out of your blood sugar level. So just be cognizant of that as well. Now, the next medication on the list has one of the strongest metabolic effects that we see, I think, in medicine. Like, it's one of those things where we know if you're on one of these medications, you need to be checking your blood sugar levels, and that is our atypical antipsychotics. Some examples of this are things like olanzapine, which is Zyprexa, quetiapine, risperidone. All of these medications are used for psychiatric conditions like schizophrenia or bipolar disorder. They can also sometimes be used in severe depression. And so, with these drugs, they can affect your metabolic pathway in a few ways. One of the main ones is that they increase appetite. And so, you're just eating more. So, you're putting more glucose into your body. That leads to weight gain, which is kind of this metabolic cycle of weight gain, high insulin levels, high glucose levels, and all of those things, of course, are going to lead to increased blood glucose, because when your insulin levels are super high, that leads to insulin resistance. And now you can't get glucose or sugar into the cells. And so all those things are just kind of a vicious cycle. But they can also alter glucose or sugar metabolism in the liver. And so you're just not metabolizing or managing the sugar as well in the liver as you normally would. Now, the guidelines for utilizing these medications recommend that we monitor on an ongoing basis weight, blood sugar, lipid, or cholesterol levels. And we will do that when we start the medication, as well as when we make modifications to the dose. Or if you're on the same dose for a long time, we'll just continue to monitor you every 3 to 6 months. Just kind of depends on how controlled you are, what other factors play into your health situation. Now, the last medication I feel like surprises a lot of people, because it is one of the most important medications for preventing heart attacks and just overall cardiovascular risk. And these are our beloved statins. Things like atorvastatin, rosuvastatin, simvastatin, pravastatin. We know that statins reduce your cholesterol levels. They also help to stabilize any plaques that could be in the arteries, which helps prevent heart attacks and strokes and things like that. And so the mechanism by which these medications increase your blood sugar isn't really fully understood, but they think that perhaps it reduces insulin sensitivity, which we talked about with other medications, and also potentially alters the pancreas beta cells and how they function. So maybe we're getting less insulin even available to take blood sugar out of the bloodstream and put it into cells. So those are potentially some ways that it might be doing this. Now, I will say that I haven't seen a profound increase in blood glucose levels in patients taking statins, but also I don't feel like we monitor for it as much. So I think it's one of those things that watch for it at home as you're checking your levels. Also, look for any trends in your lab levels that you get, and make sure that your provider kind of keeps that on the forefront of their brain as well, because these are things that if you're on a statin for a long period of time, you might see just really small changes over time. And so you might be able to pick on that with a trend rather than something happening all at one time. An important perspective to have, though, is that the increase in blood sugar levels and diabetes risk is really small with these drugs overall, and the cardiovascular or heart protection from statins is much greater than the potential diabetes risk. So if you are someone who is already at risk for heart disease or stroke, like, these statins are saving lives. They are reducing the risk profoundly. And so that benefit is going to outweigh the small risk of bumping up your blood sugar a little bit. So just keep that in mind, because we don't want you to abstain from taking a statin because it might potentially increase your blood sugar a little bit. But it is one of those that we don't often think about. So the 5 medications that can raise your blood sugar: thiazide diuretics, steroids, beta blockers, antipsychotics, and statins. And really understanding these medications is going to help you interpret changes in your health status. It's going to help you understand these medications a little bit more and how they might be affecting the certain metabolic processes of your body. And if your blood sugar has been rising and you really can't figure out why, just kind of look to your medication list and see if perhaps maybe it could be one of your medications. And often there is a solution that we can come up with, but it starts with awareness and it starts with monitoring. I hope this video helped you. If it helped you understand your medications a little bit better, please subscribe. If there's a medication that you want me to break down next, please drop that in the comments as well, because I feel like the more that we understand our medications, the safer we can use them. And sometimes we can even come off of them. And that is really the goal in a lot of situations. So thank you for watching. I'll see you in the next one.